Sudden infant death syndrome (SIDS), often referred to as crib death, is the sudden and unexplained death of an infant, typically during sleep. SIDS is a tragic event that primarily affects babies between 1 month and 1 year of age, with most cases occurring between 2 and 4 months. Understanding the causes, risk factors, prevention strategies, and support for families affected by SIDS is crucial. The exact cause of SIDS is still unknown, but it is believed to result from a combination of factors, including brain abnormalities. Infants who die from SIDS may have brain abnormalities affecting the control of breathing and arousal during sleep. Sleep environment. Unsafe sleep conditions, such as sleeping on the stomach or side, loose bedding, or sleeping on soft surfaces, can increase the risk of SIDS. Genetic factors. The family history of SIDS or other sleep-related infant deaths can increase the risk. Maternal factors. Maternal smoking during pregnancy, substance abuse, inadequate prenatal care, and young maternal age have been associated with a higher risk of SIDS. Premature birth or low birth weight. Infants born prematurely or with low birth weight may have underdeveloped brain and respiratory systems, increasing their vulnerability. Risk factors. Several factors can increase the risk of SIDS, including sleep position. Babies placed to sleep on their stomachs or sides are at greater risk. Sleep surface. Sleeping on soft surfaces, such as soft mattresses, sofas, or armchairs, increases the risk of suffocation. Second-hand smoke. Exposure to smoke from cigarettes, especially during pregnancy or after birth, increases the risk of SIDS. Co-sleeping. Sharing a bed with parents or siblings, particularly on soft bedding or surfaces, can lead to suffocation or overheating. Infections. Recent respiratory infections may increase the risk, as they can affect an infant's ability to breathe properly during sleep. Overheating, overbundling or sleeping in a hot environment can contribute to the risk of SIDS. Symptoms. SIDS is characterized by the sudden and unexplained death of an otherwise healthy infant, often occurring during sleep. There are typically no warning signs or symptoms prior to the event. In some cases, parents may notice the following. The infant appears to be sleeping soundly and may have a peaceful expression. The baby may be found in an unusual position or with their face against the bedding. Diagnosis. Diagnosing SIDS is primarily done through the process of elimination, as it is a diagnosis of exclusion. After a sudden infant death, healthcare providers will typically conduct autopsy. An autopsy is performed to rule out other causes of death, such as infection or a congenital anomaly. Death scene investigation. A thorough investigation of the sleeping environment and circumstances surrounding the death is conducted to identify potential risk factors. Medical history review. The infant's medical history, including prenatal and perinatal factors, is evaluated. Prevention. While there is no guaranteed way to prevent SIDS, certain strategies can significantly reduce the risk. Safe sleep practices. Back to sleep. Always place infants on their backs to sleep, for both naps and overnight. Firm sleep surface. Use a firm mattress in a safety-approved crib or bassinet, avoiding soft bedding, pillows, and toys. Avoid co-sleeping. Infants should sleep in their own sleep space, such as a crib or bassinet, close to but separate from the parent's bed. Room sharing. The American Academy of Pediatrics (AAP) recommends that infants sleep in the same room as their parents for at least the first 6 months, ideally up to 1 year, to reduce the risk of SIDS. Avoid overheating. Keep the baby's sleep environment at a comfortable temperature and avoid excessive clothing or blankets. Eliminate smoke exposure. Ensure that the baby is not exposed to tobacco smoke during pregnancy or after birth. Breastfeeding. Breastfeeding has been associated with a reduced risk of SIDS. Exclusive breastfeeding is recommended for the first 6 months. Pacifier use. Offering the pacifier at nap time and bedtime may reduce the risk of SIDS. If breastfeeding, wait until breastfeeding is established before introducing the pacifier. Support for families. The sudden loss of an infant to SIDS can be devastating for families. Providing support and resources is vital. Grief counseling, professional counseling or support groups can help families process their grief and emotions following a loss. Educational resources, providing families with information about SIDS and safe sleep practices can help them understand the condition and prevent future tragedies. Community support, connecting families with local resources, such as support groups or bereavement services, can help them navigate their grief journey. Conclusion: sudden infant death syndrome (SIDS) is a tragic and often unexplained phenomenon that can have profound effects on families. Understanding the risk factors, prevention strategies, and support systems can help reduce the incidence of SIDS and assist those who have been affected by this heartbreaking event. If you are a parent or caregiver, implementing safe sleep practices and staying informed about SIDS can significantly contribute to your infant's safety and well-being.